Keyin operatsiya qilgandan keyin yaxshi bo'lmadim. Keyin Toshkentga bordim. Toshkentda ham operatsiya qildi. Bu yerdagi setka qo'ydi. Setka qo'ygandan keyin xullas bu yerda yaxshi bo'lmadi-da. Keyingi borganimda
biz izlanishda davom etdik, qayta izlanib, mana shu doktor Max klinikasini topdik. Eshitib, bu yerga olib keldik. Bu yerda Vivek Mangla komandasi bilan bizni juda yaxshi qabul qildi.
RTB, an Uzbek national, underwent multiple surgeries in his native country, Uzbekistan, seemingly starting from a simple surgery for an appendicitis. This surgery led to complications, and subsequently he had one surgery after another for these complications, which led to further complications. About 6 months back, he came to us with a situation wherein he otherwise was fit and fine, but he had a chronic infection of the abdominal wall from which there was continuous discharge or feculent or enteric contents. When going through his records, we realized that in one of his previous surgeries, a mesh had been placed in his wound for hernia, and that mesh had got infected and it had fistulized with the small intestine as well as probably large intestine as well. Because of this condition, he came to us, and then we re-evaluated him, and subsequent re-evaluation told us that this was potentially a very complex surgery which is likely to be staged. After careful discussion and a detailed discussion with the patient's family, the patient underwent his first surgery with us about 3 months back, at which the entire infected mesh was removed. The involved small intestine part was removed. A stoma bag created on the abdominal wall temporarily, and with a lot of difficulty and with help from plastic surgery colleagues, his abdominal wall could be closed. When he came to us, he had wide excoriation of his anterior abdominal wall. The entire skin was damaged, and there was a lot of technical challenges because of multiple previous operations and the presence of mesh in the patient. He subsequently recovered well, went back home, and after 3 months came back for his second stage surgery, in which his ileostomy, which had been made the last time, has now been closed. Tomorrow he's traveling back to his native country, all fit and fine, with a life full of hope and being absolutely rid of all his problems that he was facing. Intestinal fistula is a complication arising from abdominal surgery. These complications can sometimes be seen after major abdominal surgeries. Unfortunately, sometimes mesh placed at hernia surgery can get infected and sometimes fistulize with the intestine, which would result in drainage of enteric contents from the abdominal wall. These cases are technically very challenging because of the mesh adhesions, the multiple loops getting adhered to the small intestine, and the mesh, everything becoming one mass, and tackling very careful surgical expertise to deal with this challenge. These patients would usually need stage surgery, after which a majority of these patients can absolutely be made fit and fine, especially if there was no cancer lurking in the background, and then these patients continue to go on and do very well after a corrective surgery. We wish Mr. RTB and his family safe travels, as well as our best wishes with them for a healthy life ahead.
yaxshilab operatsiya qildi. Mana hozir o'zimni yaxshi sezyapman. Yurtda mana endi javob berdi menga. Doktor Maglaga, uni komandasiga, mana tarjimonlarga, hamshiralarga, hammasiga kattadan katta rahmat.